Good morning, everybody. My name is Boris Mendoza Menendez. Here you can see my social media, Twitter, YouTube, Instagram, and Facebook, where you can follow me and watch the other video. Today, my topic is training hepatitis C in lower income country. We start with the definition. Hepatitis is inflammation of the liver. Inflammation is the swelling of organs that occur when the organs are injured or infected. Hepatitis C can be acute or chronic. Acute hepatitis C is short-term infections. Symptoms can last up to 6 months. Sometimes your body is able to fight infection and the virus goes away. But for most people, an acute infection leads to a chronic infection. Chronic hepatitis C, long-lasting infection. If the left untreated, it can last a lifetime and cause serious health problems such as liver damage, cirrhosis, liver cancer, and even death. We respect symptoms. Most people with hepatitis C have no symptoms. Some people with acute hepatitis C have symptoms 1 to 3 months after being exposed to the virus. These symptoms may include dark yellow urine, fatigue, fever, gray or clay colored stool, joint pain, loss of appetite, nausea and vomiting, abdominal pain, and jaundice. We respect treatment, hepatitis C treatment as a traditional recurrent weekly injection of interferon used in combination with ribavirin. The current treatment since 2011 consists of direct-acting antivirals, or DAA, like dolutegravir and boceprevir.
Major public health problem here in the United States and throughout the world. I'm Dr. Vincent Larray from Penn Medicine, and I'm an infectious disease physician and researcher focusing on chronic hepatitis C virus infection. Today I'm going to explain who's at risk for hepatitis C, how it affects the body, and what treatments are available for this disease. Hepatitis C is transmitted primarily through exposure to blood or body fluids. As a result, today, 4 million Americans are chronically infected with hepatitis C, and another 170 million people are infected worldwide. People who may have an especially increased risk for chronic hepatitis C and who should be screened for infection include those who have used injection or intranasal drugs, received a blood or clotting factor transfusion prior to 1992, have undergone hemodialysis, or are children of hepatitis C infected mothers. In addition, recent data from the CDC indicate that people born between 1945 and 1965 have a much greater risk of contracting hepatitis C. So any baby boomers should be sure to get screened. If left untreated, chronic hepatitis C could lead to cirrhosis, liver cancer, and liver failure. Fortunately, direct-acting oral treatments for chronic hepatitis C are now available. These therapies typically require only 8 to 12 weeks of once-daily pills, have few side effects, and result in greater than 94% chance of curing chronic hepatitis C. Here at Penn Medicine, we have a multidisciplinary team of clinicians, nurses, pharmacists, dietitians, and behavioral counselors, all specializing in hepatitis C and HIV hepatitis C co-infection. We perform a comprehensive evaluation focusing on hepatitis C and liver health. Our practitioners provide detailed education about all aspects of hepatitis C virus infection, including a proper diet to avoid liver complications. We have a FibroScan imaging machine that non-invasively measures liver scarring, so we can accurately evaluate and treat any liver damage. Our pharmacists will review medications to ensure there are no issues with the treatments we prescribe. We have extensive experience working with all types of insurance to obtain approvals for treatment, and we are dedicated to working closely with our patients to cure their chronic hepatitis C infection. If you think you
Hepatitis C is a major problem in the United States and really around the world.
More people are dying of hepatitis C in this country than of HIV. I think many people don't hear about what hepatitis C even is and how you can get it. So hepatitis C is just a virus. It doesn't do a whole lot other than want to live in your liver and make more copies of itself. So the word hepatitis has to do with hepa, which is the liver, anything having to do with the liver, itis, which means irritated or diseased. And we know that there are different viruses that once they're in the body, their home base is the liver. The primary viruses we see in this country are hepatitis A, hepatitis B, and hepatitis C.
So anytime someone's exposed to someone else's blood, and that could happen through blood transfusions before 92, organ transplantation before screening, people on dialysis, people with hemophilia, as well as people who inject drugs. All were identified as high-risk populations, as were people living with HIV, because many of the same modes of transmission for HIV are also true for hepatitis C. Their immune system tries to fight it, and this battle goes on in a very silent way in their liver for 10, 20, 30, 40 years. And it may also be causing other problems. Hepatitis C is linked to things like the development of type 2 diabetes, as well as lymphomas and kidney disease. But what happens to some people is over time, their livers scar, leading to cirrhosis. But it's only at that stage, when the liver can no longer function, that symptoms become obvious.
You're having all that itching, that's because your liver was acting up.
I had no symptoms. It didn't affect anything that I was doing. So I didn't respond to it.
And once you get cirrhosis, your liver can stop working.
And the idea is, if you don't know you have it, you can't get the treatment and you can't be cured.
Okay, application in medicine. Here we have two aspects: high cost treatment and solution to the problem. High cost treatment. Low and middle income country account for over 80% of the global burden of hepatitis C, with the majority of infection in South Asia, East Asia, North Africa, the Middle East, and Southeast Asia. Phenotypes 4, 5, and 6 of hepatitis C are particularly common on this area. Most patients with hepatitis C infection in low or middle income countries don't receive treatment. Hepatitis C treatment has traditionally required weekly injection or interferon used in combination with ribavirin. This treatment is expensive, resulting in a challenge in resource-limited settings, including the cost of interferon formulation, prolonged courses of treatment from 6 to 11 months, and adverse effects including influenza-like syndromes, cytopenias, infection, depression, and liver decompensation. We respect solution to the problem. For this reason, in 2011, the first generation of direct-acting antivirals DAA, like tenofovir and boceprevir, was approved. In addition to the improved sustained virological response rate with these drugs, it is greater than 90%, with minimal adverse effects and drugs interactions and short courses of treatment of 2 to 3 months, and the possibility of single pill, and also the dose combination fixed. Having a high cure rate without the need for interferon, also many of these drugs have an excellent response to most hepatitis C phenotypes.
So health coverage is now part of the Sustainable Development Goals. At our workshop on the topic, participants from Africa, Asia, and Latin America considered the progress towards achieving UHC and the role research can play to improve the quality of care provided in low and middle income countries. Delegates highlighted barriers and challenges to implementing quality of care research in LMICs, such as low prioritization of quality of care over financial considerations and the effective use of data. Insufficient health systems research emerged as a common challenge. However, many success stories of quality of care interventions exist, including the improvement of public-private partnerships in Africa, use of health technology assessments in Asia, and vaccination programs in the Americas. The workshop identified key research priorities, providers and users' perspectives on barriers to quality of care, how to build on current resources and capacity, the adoption of digital technologies, how to strengthen human resources to improve soft skills and frontline workers' welfare, and addressing organizational and leadership cultures to create a more supportive culture. Delegates recognized opportunities for collaboration to address these challenges, creating global and regional academic networks to enhance advocacy and skills development, establishing an open repository for grey literature to share experience, integrating quality of care in healthcare and medical curricula, forming mentorship networks to transfer skills and knowledge across generations.
Okay, pros and cons. We respect pros and has consistent virological response rate greater than 90%, minimal adverse effect, few drug interactions held in without the need for interferon, respond to most hepatitis C genotypes, less time of oral treatment and with fixed dose would generate a lower cost for the patient. Cons, drug costs that can excess $90,000. Most patients with hepatitis C infection in low or middle income country don't receive treatment, and a manufacturing cost of fully oral like DAA basic 3-month course of treatment is estimated to between $100 and $270.
What are the pros and cons of interferon for hepatitis C? Using interferon is often the only treatment option for people who have hepatitis C, although it won't repair damage already done to the liver. Interferon has the potential to completely eliminate the virus from the body. Those who show no signs of the hepatitis C virus after finishing treatment are considered cured of the disease. Among the negative aspects of using interferon for hepatitis C, though, are its low rate of success, the length of the treatments, and a relatively high rate of side effects. Hepatitis is medically defined as an inflammation of the liver. This swelling can result from many things, so it generally is defined by its cause. The diagnosis of hepatitis C is defined as swelling of liver caused by the hepatitis C virus. Even though a patient is infected with hepatitis C, he or she might show no ill effects of the virus. If there is no damage to the liver and virus levels are low, there might be little benefit to be gained from interferon therapy. Often, close observation of virus levels in the blood might be the only medical intervention that is needed. When the hepatitis C virus levels become high enough to damage the liver, or when liver damage has already occurred, the patient is often treated with interferon. Interferon treatment is not free from problems. People using interferon for hepatitis C can become depressed by its relatively low success rate. Only about half of all patients will ever be diagnosed as cured. Often, this number is even lower in minority groups. Compounding the negativity of a low success rate is a high rate of side effects. Fever, chills, and muscle aches are common during treatment. Many individuals using interferon for hepatitis C report these flu-like symptoms to range from moderate to severe. Often, these symptoms reoccur frequently throughout the entirety of the treatment. Using interferon for hepatitis C typically requires 24-48 weeks. During this time, individuals are required to receive weekly injections of the drug and are closely monitored. A number of
Israel played in Ecuador. Sofosbuvir, declastavir, and the combination of sofosbuvir and ledisavir have been used recently in Ecuador are part of the preferred treatment and can achieve cure rates of over 95%. Conclusion. This effective cure will be achieved through short and convenient courses of single pill regimen with non-fixed interferon, those with adverse effect profile that are remarkably better than those of past treatment. However, with drugs costs that can exceed $90,000. Most patients with hepatitis C infection in low or middle income country don't receive treatment. Okay, thank you for your attention.